it'll hold off. All right, so we'll get started. So briefly, I'm going to go over the mission and history of the Elizabeth Dole Foundation. I'll talk a bit about our Caregiver Journey Map, and then really dive into the campaign for inclusive care. And we'll go over what inclusive care is, why it's important, what the caregiver experience has been like before inclusive care was implemented, how we've implemented inclusive care, the Academy for Inclusive Care, how we practice it, and then some of the outcomes and evaluations. So what we've learned since implementing inclusive care. And then I'll also share some resources related to inclusive care and also resources that the Elizabeth Dole Foundation has for caregivers outside of the campaign for inclusive care. So the mission of the Elizabeth Dole Foundation is to strengthen and empower America's military caregivers and their families by raising public awareness, driving research, championing policies, and leading collaborations that make a significant impact on their lives. And one thing to note here is when we say military and veteran caregivers, we are not only talking about family members. These can also be friends, they can be neighbors, they can be colleagues, anyone who's really involved in the care of the veteran. So just a brief history. The Elizabeth Dole Foundation was founded in 2012 by Senator Elizabeth Dole after she spent time at Walter Reed Army Medical Center, where she was supporting her wounded husband, Senator Bob Dole. And while she was at Walter Reed Army Medical Center, she connected with other caregivers and she learned all about their needs and really recognized that there was a gap in services to address the needs of military and veteran caregivers. So she began the foundation in 2012, and one of the first things that she did was commissioned the RAND Corporation to conduct a study on the needs and gaps in services for caregivers. And this was a pretty big deal because it was the first national comprehensive evidence-based study of military and veteran caregivers. And that took about 2 years to complete, and those findings were released in 2014. And this work, the findings from the RAND report really grounded all of the programming that the foundation has gone on to develop since. And then in 2013, we launched our Dole Caregiver Fellows program. This is an opportunity for military and veteran caregivers to really represent the foundation in a formal capacity and advocate for the needs of caregivers at a local and national level. And our caregivers, our fellows, they really are the heart and soul of our foundation. We go to them a lot for their input, for advice, to make sure that all of the programming and resources that we're developing are actually going to be helpful for caregivers. So really, all of what we do is focused on the caregiver, and we couldn't do the work that we do without our caregivers and especially our fellows. And then going ahead to 2016, we launched the Hidden Heroes campaign, and this really involves a number of different programs, including our Cities and Counties program, our online community for caregivers, as well as a few other programs and resources, which I'll go into detail towards the end of the presentation on. And then in 2020, we launched our campaign for inclusive care. And then in 2021, we launched our newest initiative, which is our Hidden Helpers work, and that is focused on the children in caregiving homes who are oftentimes providing care to a wounded, ill, or injured veteran themselves. So going back to the RAND report. So that was commissioned in 2012 and it was published in 2014. Again, this was a first of its kind comprehensive evidence-based national study of military and veteran caregivers. And it really examined the needs of caregivers as well as gaps in services and provided recommendations. And to sum up this huge report, it revealed a societal crisis requiring a holistic national response. In particular, this report revealed that there are 5.5 million military and veteran caregivers all across the country. Many of them are either the sole breadwinner for their families or they've given up careers to attend to the needs of their wounded, ill, or injured veteran. And on top of all of this, they're managing a household, raising children, maybe navigating some legal and financial challenges, and providing that 24/7 support for their veteran. And this results in higher rates of anxiety and depression and deteriorating health for caregivers. So this study also revealed is that in this care that caregivers are providing to their veteran, they're essentially performing healthcare tasks. And so this highlighted a need for caregivers to interact with their veterans' healthcare providers. But what caregivers shared during the study was that some of the healthcare environments that they were interacting with were not as understanding or accommodating to their engagement and involvement in the care of their loved one. The study also revealed that the best chance for a wounded, ill, or injured veteran to recover and thrive is by having a well-supported caregiver. And part of that support comes from being included in critical conversations around the veteran's care, particularly their medical treatment. So we know that caregivers are often dispensing medications, providing wound care, keeping track of appointments, assisting with activities of daily living. And so again, they're really providing a lot of critical medical care to their veteran. And in order for them to receive the support that they need to be included in conversations with the care team. So this study led to the development of our Caregiver Journey Map. And this was developed in collaboration with experts from the VA as well as Philips. And it really provides information on the evolving needs of caregivers and identifies opportunities where organizations and service providers can deliver evidence-based interventions and provide support. And one of the key findings from this as it relates to inclusive care is that those initial visits and engagements at the VA or wherever their veteran was receiving care is really, really a critical point in the caregiving journey. And caregivers feel very vulnerable during those first initial engagements. And this is kind of tough to see, but the Caregiver Journey Map is actually, it's very, very detailed. It's available on our website. So I would encourage you to visit our website if you have time. And it really goes into a lot of detail on the components of this map. So we have routes, landmarks, turning points, and key needs. And again, if you go to the website, you can really break down the different details. So for example, we have 3 stages in the Caregiver Journey Map. So stage 1 is becoming aware. So the caregiver notices a change in the veteran or service member's behavior. And these begin to affect the dynamic of their relationship. And the caregiver starts to take on extra responsibilities at home, may struggle with focusing in their day-to-day life because of these new responsibilities. They may start to feel uncertain. They may feel more stressed. They may feel overwhelmed. And they may want to seek help, but also not want to disrupt the normalcy of their day-to-day. They also at this point start to maybe lose some contact with their friends, their family, or their community. So they're starting to experience some isolation in that first stage. And so what the Caregiver Journey Map will do is it'll break that down, and then it'll also explain, during that time, during this particular stage, a caregiver may need increased opportunities for self-care. They may need respite or counseling or access to more community-based resources. So definitely encourage you to check this out, check out the other stages to really understand where a caregiver might be at in their journey when you're interacting with them. So now we'll dive into the Campaign for Inclusive Care itself. So the Campaign for Inclusive Care is a joint initiative between the Elizabeth Dole Foundation and the U.S. Department of Veterans Affairs, and it is funded by USAA. And the mission of the Campaign for Inclusive Care is to empower healthcare providers and professionals to engage veteran caregivers as part of the veteran care team through policy, practice, and culture change. And the goal is to really shift the culture of care at VA to be fully inclusive of caregivers. Now, we know that's a big undertaking. VA is a huge system, and culture change also takes time. So this isn't something that we anticipate completing in a year or even 5 years. We are actually on year 5 of the campaign. So we know that this is an approach that we have to take slow and really make sure that we're getting it right and that we have buy-in from clinicians and staff. So I am going to play a video that just gives kind of a high-level overview of the campaign with using a baseball analogy. So let me just take my headphones out and let me know. Hopefully you'll be able to hear this.
They're down, but not out. Time is short, and everything is on the line. You wouldn't walk onto the field without the best, most well-equipped team available to you, would you? Of course not. Currently, there are often missed opportunities in clinical settings by not creating a system and practice of more inclusive care teams that equally encompass the wounded warriors, caregivers, and providers. Caregivers can be a huge asset to doctors and other care providers, but only if they're in the game, or rather in the room, when the plans start being drawn up. That's what we mean when we talk about the Campaign for Inclusive Care. The Campaign for Inclusive Care, in partnership with Elizabeth Dole Foundation, the U.S. Department of Veterans Affairs, and supported by USAA, is working to shift the culture of care to be fully inclusive of family caregivers, so the veteran health outcomes are improved, the caregiver experience is better, and clinicians and staff are more supported in their important work. By remembering to CARE, we can make sure that we've got the full strength of our team, caregivers and all, and make sure that we're giving our all to those who have given so much for us.
All right. So as you can see from that video, there's often missed opportunities in clinical settings when inclusive care is absent. So that is when the care team does not equally encompass the veteran, their caregiver, and the providers. And caregivers are a huge asset to doctors and other care providers, but only if they're in the room or a part of the conversation when the care plans are drawn up. So let's dive into inclusive care a little bit more. Oh, one. No. All right. So what is inclusive care? So inclusive care is a system-wide approach to veteran care that embraces, engages, and empowers caregivers, clinicians, and veterans throughout the entire care journey. It increases the capacity and competency of the entire care team to deliver appropriate, efficient, effective, and high-value services. It improves health outcomes, relationships, quality of life, and supports system-wide performance. It's team-based, with care being a partnership among the clinical veteran care team and family caregivers, and it's centered on sound communication and secure feedback from all care partners. And why do we need inclusive care? So we've mentioned this, or I mentioned this a couple of times. So we know that the best chance for a wounded warrior to recover and thrive is by having a strong, well-supported caregiver. We also know, again, that one of the most vulnerable points for a caregiver is those initial clinical visits with their loved one. We also know that the caregiver is providing most of the care outside of hospital walls, so their input and understanding is critical for improved patient outcomes. And then inclusive care improves outcomes and experiences not only for the veteran, but for the caregiver and the clinician as well. So with the Campaign for Inclusive Care, we have a quadruple aim. So we want to improve quality of life for caregivers of veterans who are receiving services at VA or within another healthcare organization. We want the patient experience and their health and well-being to improve. That would be the veteran. We want the per capita cost of healthcare to be reduced, so that benefits the healthcare system. And then we also want providers and staff within the hospital setting or the clinical setting to find more joy in their work or feel less burned out. So when a caregiver is involved in the conversation, they're able to provide critical information to the care team that maybe that veteran hasn't shared. And when they do this, the clinical team is able to make better, more informed decisions around the veteran's care and treatment. They're also able to check in with the caregiver to make sure that the caregiver is able to adhere to that treatment plan in between appointments. And so when the caregiver is involved and they understand their role and they're able to help their veteran adhere to that treatment plan, the veteran's health outcomes are going to improve. And when patient health outcomes improve, ideally clinician burnout will also be reduced. So the campaign for inclusive care, by including caregivers in these conversations, really benefits the veteran, the caregiver, and the provider and staff. So we implemented the campaign for inclusive care by first beginning with research, which I'll dive into a little bit more. And then we piloted the campaign. And then we expanded VA-wide. We launched the Academy for Inclusive Care. We developed an additional training on top of the Academy for Inclusive Care. And then we encourage VA clinicians and staff to host lunch and learns, distribute care kits, host summits and resource fairs. And then lastly, throughout this whole process, we've been working with a quality improvement team to evaluate the campaign's effectiveness and impact. So from the very beginning, everything we do is grounded in research. Again, that RAND report from 2014 really was big in informing the development of the campaign for inclusive care. And so that report identified that care environments should make efforts to acknowledge caregivers as part of the healthcare team. And then another report, the Families Caring for an Aging America, identified that practical approaches for inclusion and engagement of family caregivers was poorly defined. So that was an area that the campaign for inclusive care could address. And then this research blueprint that was also published by RAND identified effective programs and policies supporting caregivers' ability to provide care was rated highly important to caregivers. Caregivers are often thrown into care with little knowledge of where to turn for guidance. So again, we want to be able to empower and support the caregiver in their role in providing care to their veteran. So our quality improvement team completed a literature review, including those research studies on the slide before, and then set about interviewing and surveying caregivers directly to better understand their experience. And through these interviews and surveys of caregivers, we found that inclusion on the care team was not the norm. And this study was done in 2017. And as you can see here, over a 6-month period, 56% of caregivers were never asked for their ideas about managing their veterans' health. 69% of caregivers were never asked whether they have the skills or training needed to do the tasks that were asked of them. And 72% of caregivers were never asked if they needed help at home in managing their veterans' health conditions. And then we asked caregivers to identify what they perceive to be the top barriers to their inclusion on the care team. And they shared that a lack of time by the medical staff to deal with the caregiver was one of the main reasons. Because they're not a provider, the care team doesn't think they need to know any of the detail about their veterans' care. The providers cited legal or privacy concerns. The healthcare team changed frequently, so maybe they didn't have a strong point of contact. And also the healthcare team didn't know that they were a caregiver. So that's also a big component of the campaign is identifying when a veteran has a caregiver. So from our interviews, our surveys, the literature reviews, we learned that caregivers have more health problems, they face greater strains in their family relationships, and have more workplace issues than non-caregivers. Therefore, we needed a system-wide change to better equip caregivers and empower them to join care teams. So we held a summit. This was back in late 2017, early 2018, with clinical healthcare experts, caregivers, providers, and experts from the VA, where we created a solutions team and began drafting scripts for what would become the Academy for Inclusive Care, which is one of our main training components on inclusive care. And then in January of 2020, the Academy for Inclusive Care was launched, and the campaign for inclusive care was officially launched as a pilot at Visits 2017 and 10. And then after a successful pilot that was supported by our quality improvement team, we expanded VA-wide in October of 2020. So inclusive care has been rolled out all across the country, across all visits. So the Academy for Inclusive Care is one of our main training resources for providers. And the Academy for Inclusive Care is made up of 4 online training modules. They're about 15 minutes each. They're narrated by Dr. John Torres. And they're pretty interactive, if I do say so myself. It's not like this. It's not someone just narrating a PowerPoint. There's music, there's videos of caregivers sharing their experiences. So I definitely think they're pretty engaging and would strongly encourage you to check them out. They are available for free. And I do have, the link is to our website is on this slide, but then it's also on a later slide. You do have to register to access the videos, but again, otherwise they are completely free. So the first module is the introduction to the practice of inclusive care. And in this module, you'll learn how to define inclusive care, learn the key features of inclusive care, the benefits of creating an inclusive care environment, and be able to identify and explain the caregiver role as it pertains to inclusive care. And then this module will also go into initial action steps that you can take to create an inclusive care environment to really bring together healthcare providers and other healthcare professionals within an organization. And then the second module, who are military and veteran caregivers. This is where we define who a veteran caregiver is, the roles that they may play in helping their veterans' healthcare, and then also we begin to describe the stressors that a caregiver may be experiencing. And then in communicating with the caregiver, this module really dives into the value of clear mutual communications between providers and caregivers. And then it also goes into regulations and laws about provider caregiver communication. So really diving into HIPAA and other legal privacy concerns that you may have. And then in the final module, understanding the caregiver journey, this is where the Academy dives into that caregiver journey map. So to understand those different stages, different landmarks that make up the caregiver journey. And this is also a really good way to just kind of raise awareness about the context of a caregiver's experience. So what might they be going through when they come into an appointment with their veteran? And then within the Academy for Inclusive Care, you'll become familiar with this acronym, which you also saw in the video, CARE, which stands for Consider, Acknowledge, Review, Roll, and Encourage. So consider, this is where we are really helping to identify the caregiver. So when a caregiver shows up for an appointment, asking the veteran, hey, is there someone who helps you out at home? And if that caregiver is still in the waiting room, how about we pull them in to the room and invite them into the conversation? And within it, when the provider is asking this, they don't necessarily have to ask, hey, do you have a caregiver? Because again, not all caregivers identify as caregivers. and not all veterans refer to their caregiver as a caregiver. So asking, is there someone you would like in the room, or is there someone who helps you out at home, can be a really good way to make sure that that caregiver is included and invited into the conversation. And then acknowledge. So recognizing that a caregiver has taken on a lot of extra work and responsibility that is going to have an impact on their wellness. And so here we really just want providers and staff to be empathic and really validate all of the work that the caregiver is doing. And then review role. So here's really where the clinician should be determining what the caregiver is comfortable with. So what tasks are easy for them to perform? Is there anything that they feel uneasy with? And by doing this, the care team will be able to ensure that the veteran achieves their highest possible health outcomes by making sure that the care that they are planning for, the caregiver can carry out. And then lastly, encourage. So find out any barriers that exist and help the caregiver overcome them, help them make their responsibilities a little bit easier. Here especially, we recognize a lot of caregivers may be reticent to ask for help. So we encourage the providers to proactively ask if there's anything that the caregiver needs support with, and then make an appropriate referral based on the caregiver's identified needs. So again, just going into a little bit more detail for clinicians and staff, they're encouraged to invite the caregivers into the room, into the conversation, greet caregivers, make introductions and know their role, inform everybody in the room of the visit's purpose, ask caregivers questions to learn more about them, discuss any findings, maybe from labs or tests that they've run with the caregiver and the veteran, and then discuss next steps for their care. And then at the end of the appointment, ask the caregiver and the veteran to summarize what the next steps are. And this way we can ensure that everybody on the care team has the same understanding of the treatment plan. And then again, make a warm referral to support services if the caregiver has identified a need. And then caregivers, so we recognize that inclusive care is a two-way street. So we really want caregivers to feel empowered to take an active role on their veterans care team as well. As much as we would love for clinicians and staff to always invite the caregiver into the conversation, not all caregivers and staff are going to do that. So we want to make sure that caregivers also feel like they can advocate for their role on the care team as well. And also make the best use of their appointment time. So we encourage caregivers to establish appointment goals ahead of time with their veteran, really be confident in their knowledge and expertise on their veteran and what's going on at home. And then identify any staff or clinician on the veterans care team who they feel like they can trust and contact whenever they need someone to ask a question or need some advice or need a referral for another service, but really identify that one member of the care team who they feel they have a connection with. So going back a little bit, so that was the Academy for Inclusive Care and how to implement inclusive care. As I mentioned earlier, all of what we do is really grounded in research, and a big piece of the campaign for inclusive care is our work with our quality improvement team, who are based out of UT Health San Antonio. And they have been with us since the earliest phases of this campaign, really evaluating inclusive care and the impact of it to make sure that we are delivering a service that is helpful and effective. So back in 2020, when we piloted the campaign for inclusive care at those 3 visits, our quality improvement team did assess the pilot. And they found that 92% of clinicians had an increased interest in practicing inclusive care following completion of the Academy for Inclusive Care modules. 94% felt an increased need for self to practice inclusive care after they completed the Academy modules. And 8.9 their self-efficacy increased from 7.92 to 8.9 after having completed the modules, which was statistically significant. So they felt like they could practice inclusive care after taking the modules. And then in 2021, we surveyed providers again, our quality improvement team, and they found that 86% of providers were confident that they would include caregivers as part of the medical team. 60% reported that the Academy for Inclusive Care modules helped them improve their provider skills. And 80% rated the Academy for Inclusive Care as relevant to their role and practice. And currently, our quality improvement team is conducting an environmental scan. This is our latest phase of our quality improvement work. And again, being led by those same researchers at UT Health San Antonio. And the purpose of this is to really assess the unique elements and characteristics of the National Campaign for Inclusive Care, its implementation, and the effects on VA healthcare providers and staff, as well as caregivers and veterans. And this will be done by surveying and interviewing VA providers, staff, caregivers, and veterans. So we really want to ensure that everybody is having a voice and making sure that everyone's experiences and perspectives are being captured in this environmental scan. So we, VA providers and staff can say, hey, yeah, we're practicing inclusive care, but if that's not being experienced by caregivers and their veterans, we need to know that. So that's why we're making sure that all of these different members of the care team are being included in the environmental scan. So if you, I know that was a lot of information, but there is more. So if you do just want to dig in a little bit more, we have a ton of resources on our website. Again, you can take the Academy for Inclusive Care through TRAIN, which is the learning management system of the Public Health Foundation. All you have to do is make an account, and then you can access the courses for free. We also have resources available to download, and then we have our care kits, which I'll show you. So these are just some of the resources available on our website. So again, that Caregiver Journey Map, you can download a PDF version, but you can also interact with it on our website to see the videos that support it. You can also check out the VA directive for inclusive care, some of the research that's been published on inclusive care, and then also check out those RAND reports that were really that really grounded all of this work. And then we also offer care kits. So these are boxes of materials. So these include these care cards that you see in the blue and red. The blue is for clinicians and staff to share with their colleagues to encourage them to practice inclusive care. And then the red is for caregivers or veterans to share with their providers or the staff at their healthcare facility. And on the back of those blue and red cards is that CARE acronym. So it really serves as a good reminder on those key components of practicing inclusive care. And then we also have one-pagers and checklists on how to practice inclusive care. And I did email a couple of those one-pagers to Emily. I'm also happy to mail out any of those cards if anyone wants hard copies of them. And then coming soon, we have our Caregiver Toolkit. So this is something that we are really, really excited about. So as I mentioned before, inclusive care is a two-way street, and so much of the work that we've done so far has really focused on equipping providers and staff with the tools that they need to include caregivers. And now we're really focusing on how do we equip and empower caregivers to take that active role. So our Caregiver Toolkit will provide an overview of inclusive care so that caregivers do have an understanding of what inclusive care is and what we mean when we say inclusive care. And then we're really going to break down a couple key areas that caregivers have identified as challenges for them to participate on their veterans care team. So first is communication. So we are going to provide caregivers with tips and actual sentences that they can memorize, or they can bring with them in a little notebook or a card, on how to communicate respectfully with the veterans care team and really advocate for their role in the room and as part of the conversation. And then we'll dive into official status. So with the VA in particular, and this will vary across healthcare systems, but at the VA, caregivers can register as caregivers, and then they are included in the electronic medical record. And so we provide information on how to make sure that you are included in the electronic medical record as a caregiver, and then also go into the importance of having a release of information signed or a power of attorney, whatever may be most applicable to that caregiver's situation. And then responsibilities. So here we're really breaking down the responsibilities of the caregiver, of the veteran, and of the clinician. And the importance of identifying which member of the care team is responsible for what. And then preparation. So we really want to equip caregivers with information and tools to make the most of an appointment. So this will include setting those appointment goals ahead of time, writing down any key information that you want to share with the provider, any questions that you have for the provider, as well as space to take notes during the appointment, and then any follow-up information and day of information that they gather in that appointment. And then part of that, we are also including a space for caregivers and their veteran to really reflect on how the appointment went. So what went well, what could have gone better, so that going into the next appointment, they can look back and say, oh, well, this didn't go as well as it should have. How can we improve on that for next time? And then we'll also include some information on self-care for caregivers as well. And then the instructions for the caregiver worksheet, that's going to encompass the preparation for the appointment and the roles and responsibilities. And they can fill one of those out every time they go to an appointment. So more to come on that. We're really, really excited for that. And then lastly, I know I've been talking for a long time and throwing a lot of information at you. But I did just want to name a couple of resources that the Elizabeth Dole Foundation has for caregivers. And these are not a part of the campaign for inclusive care, but they may be helpful to some of the caregivers that you all work with. So first is our Hidden Heroes caregiver community. And this is an online space for caregivers to come together and connect with each other. It is a private Facebook group, so caregivers do need to register and get approved to join. But the reason we do that is because we want to ensure that this is a safe space for military and veteran caregivers. So they do have to submit proof of service, but once they do that, they'll be admitted into the group. Again, this is a Facebook group. It is moderated by other caregivers, and it really is a space for caregivers to come together to ask for advice, to share advice, to receive emotional support, whatever it is they may be. And I think a lot of our caregivers really find value in being able to share maybe what they've been through as a caregiver is now going through it themselves. So often what we hear from caregivers is that they have all of this knowledge and expertise in a very particular issue, and they have nowhere to share it. And so this online community can also be a really good way for caregivers to give back to other caregivers who may be earlier on in their journey. And then we have our respite relief program. And this is a completely free resource. We offer 35 hours of free respite care, and we do this in partnership with CareLinks. So the foundation itself, we don't send in care providers, but CareLinks will send in their trained care providers. And those care providers can help with meals, transportation, companionship, med reminders, bathing, housekeeping, exercise, mobility, toileting, and grooming. And this is a really good opportunity for any caregiver who wants respite, but also if a caregiver has never utilized respite before, this is a really good introduction to respite. It's only 35 hours. The hours do need to be used in 4-hour increments. But again, really, really good introduction to respite, or if a caregiver has used respite elsewhere and maybe run out of hours. And then lastly, we have our Hope Fund for Critical Financial Assistance. This is our newest resource that we've offered for caregivers. This just launched a couple of months ago. And this provides emergency financial relief to military and veteran caregivers through grants. So the way that this works is a caregiver can submit an application for some type of service that they need covered. So it could be for natural disaster, medical or dental bills, home repairs, emergency transportation, vehicle modifications, maybe a home appliance broke, or they've lost their income. They can submit an application, and then they also need to submit either an invoice or an estimation of the cost of service. So the way this program works is the grant gets paid directly to the service provider. It doesn't go to the caregiver directly. That's just something to keep in mind. And in terms of the amount of financial support that can be offered, this really is decided on a case-by-case basis. So that is why there is no specific information on that. And that is all I have for you. Again, I know that was a ton of information. So if anybody has any questions, feel free to drop them here, or you can always send me an email. I'm happy to connect with anybody.
Well, thank you so much. And everyone says thanks to the chat box, and thank you all for attending this webinar today. We do have a couple questions that came in the chat box. Do you know by chance if the caregiver hotline number that the VA has, is it for those veterans who are already enrolled in VA, or can anyone call who is a caregiver or a veteran call that hotline number?
I believe any caregiver can call. I don't think you need to be enrolled in the caregiver support program. I'm not positive, but they may also enroll you. If you call, they may provide you with information to enroll as well, because I know it can be used for that purpose.
Great, thank you. Another question came in is, do you mind repeating the name of the company that offers the respite care? And do they serve in rural areas?
Yes. So the respite relief program is offered in partnership with CareLinks. But the foundation, we process all of the applications, and we coordinate with CareLinks on getting a care provider. CareLinks is available all across the country. However, in more rural areas, it may take a little bit longer to find a CareLinks care provider that's available. So that is one thing to note. However, what's really cool about our respite program that I didn't mention is if you say you're a caregiver and you have, there's someone else in your home or a relative who's willing to come into town and provide care for your veteran, they can actually receive training through CareLinks and then be compensated for those 35 hours of care that they provide your veteran. So something to also keep in mind, that is a good opportunity if you didn't want a CareLinks care provider to come into your home, or maybe that CareLinks care provider wasn't available when you needed them, but a family member was.
Great, thank you. We have another great question that came in, especially, with our organizations being hospices. Are they eligible for respite care if their loved one is a veteran on hospice?
Yes, they are.
Great, thank you. Is there any other questions? Feel free to drop it in the chat box, Q&A. Oh, there we go, perfect. Is pre-need planning included in the campaign for inclusive care? Do they need to have a pre-plan for the veteran's caregiver?
No, I don't believe. I also am not super familiar with that. So no, I'm gonna say yes.
Awesome. And, if one of our hospices has any questions or anything regarding the campaign for inclusive care or wants to share it with their staff, can they share a link? And if they want to keep track of who's watching the education, is there a way to do so, or is it a trust basis?
Yeah, so definitely feel free to share any of the information that you learned today, any of the resources that get posted. Definitely, you can share those. Also, the link to the Academy for Inclusive Care, it is publicly available, so you can share that widely with your colleagues and your staff. If you're interested in knowing who's taken it, I can certainly pull a report for you. One thing to note is that for us, just the way the LMS is set up, for us to be able to provide you with a list of names, everyone needs to register for the Academy through the link that we'll share with you. Just if they register through a slightly different portal, we unfortunately can't see their name. So that's just one quirk with the learning management system. But yes, if you distribute the link that's in this presentation, or I can email that out to whoever asked that question. I don't have the Q&A or the chat pulled up, but I can send you the link directly, and then you can distribute that. And whenever you want a report of who's taken it, I can share that with you.
Awesome. Great. Thank you so much.
Yeah.
Is there anything else you want to share with our folks before we start wrapping up?
No, again, just if anybody has any questions, any feedback as well, we recognize that this was really developed for VA clinicians and staff, but we do believe it's really applicable beyond VA. And that is something that we are working on to really spread the word about inclusive care and training on inclusive care beyond VA, and eventually, modify and adapt these materials to be more widely applicable. So any feedback, anything we should know, especially given all of your work in palliative and hospice care, what do we need to know about inclusive care specifically in that setting? So, my door is open, and I would love to have more conversations with anybody.
Yeah, thank you so much. We do have one more question. The webinar will be recorded, is currently recording right now, and it will be linked and available on our website in our resource library. And it will be the first one up top, since it's the most recent webinar that we have done this week. So keep an eye out, and thank you all so much for these wonderful questions. If anyone has any questions, feel free to email us, myself, or Liesl, and we can always connect you together. My email is veterans@nhpco.org. It's in the chat box. You can also email me or call me if you ever need anything. We are more than happy to connect you with any resources that we have. And thank you all so much for being here today. Greatly appreciate you taking the time on your very busy day. And we hope you have a wonderful rest of your week and stay healthy out there. Thank you.